good morning to all of you. It's afternoon, of course, here. So thank you for the invitation to participate in your seminar series. I'm sorry that I can't see or be with all of you, but we'll hope that technology is kind to us today. And thanks to Ferran for that very nice introduction. So I'm going to speak to you today about a paper that I co-authored with a colleague who's at the University of California at Santa Cruz, Sara Niedzwiecki. Sara is also, she's worked extensively on social policies, particularly in the case of Argentina and Brazil. And she has a book out on the implementation of social policies in Argentina and Brazil. So this is a very new project, and Sadi and I are pleased to get any kind of feedback that we can. So I'll look forward to your questions and to your suggestions for how we can improve this. Ferran, you can change the slide. So the paper that I shared with all of you really begins as an effort by Sadi and I to think about changes to social welfare policy in the post-commodity boom era. So what we know is in the first decade of the 21st century, Latin America saw tremendous changes to social policy. We think about this as what we might call the expansionary era that lasts roughly from 2000 to 2010, though a little bit longer in some countries. And it's a period where we see much of the region engage in significant social policy reforms, expanding access to programs, in some cases increasing spending, and increasing the coverage, and loosening, in some cases, eligibility rules for access to benefits. And here on this slide, I've just put what are kind of four of the big programs or the big important social policy developments that happen in this expansionary phase in the four cases that Sadi and I are looking at in this paper. So the first is the very well-known conditional cash transfer program, Bolsa Familia, which is rolled out in Brazil and provides an income subsidy to low-income Brazilians in exchange for their agreement to send their children to school and to attend public health screenings. The second is Plan Auge, which was a healthcare reform in Chile, which guaranteed coverage to all of the population for a set of first 56 illnesses. That has been expanded there since. And sort of instated this notion of social rights and access to healthcare as a right in the Chilean context. Down on the lower left hand, we have the Sistema de Cuidados in Uruguay, which was a national care system, which is really pretty new, even in the context of European welfare states, in that it seeks to provide care services, both child care services and elderly care services, to the bottom roughly 50% of income earners. Then we have the Asignación Universal por Hijo, which is Argentina's conditional cash transfer program that was created during the administration of Cristina Fernández de Kirchner. You can change slides, Ferran. So as Sadi and I came to this paper, we knew that these had been really significant advancements that had been made in the region, but by 2010 to 2012, the so-called commodity boom, the very favorable terms of trade that the region had experienced, were coming to an end. So on this graph, we can see rates of GDP growth from 2002 through roughly 2018. And what you can see from 2002 through roughly 2010 is very high levels of GDP growth that reflects these very beneficial terms of trade for the export of commodities. And those started to dry up around somewhere between 2010 and 2012, and we see the rates of growth decline into low levels, or in some cases, negative terrain. And so, of course, onlookers in the region started to think, well, if growth slows down, what is going to happen to these social policy expansions? Will they be able to be maintained? Will they be rolled back? Or will they be maintained in a new setting? Can change the slide. And we can think about these changes, of course, on the economic front, but on the political front, round about 2010, we were starting to see some significant shifts as well. The region was moving from the so-called pink tide, or the rise of left governments in virtually all countries across the region, with a handful of exceptions, to a series of right party victories and the return of the right or center right to the executive branch in a number of countries, notably in our cases in Chile in 2010, and in Argentina in 2015, and Brazil 2016. So as we looked at this, we thought, well, this is a moment where we could expect some significant change to social policy. We have growth drying up, and we have the return of right or center right governments to power. And what we know about the combination of those two facts is that we might see a rolling back of that expansion. If we look at social spending in the region, though, and these are graphs on the left, we have public spending as a share of GDP in the 4 countries, and on the right, we have public spending of social protection as a share of GDP. We can see that we don't really see significant downward trends, with a couple of exceptions. If anything, we see pretty steady upward growth from 2010 on, both in the healthcare sector and in the social protection sector. We can change the slide. And so this led Sadi and I to a series of questions. And we had published a paper specifically on Argentina and Chile and the 2 center-right governments there. And what we had found was that those governments didn't tend to retrench policies. In fact, in some ways, we saw expansion. But to our mind, that expansion looked slightly different from the kind of expansion that we had seen under the center-left governments in the first decade of the 21st century. And so it pushed us to think about whether or not we have the tools to understand these transformations in social policies. So the questions that drive this paper are, first and foremost, to understand what has happened to social policy since the end of the commodity boom and since the rise of these center-right governments. And have we seen continued expansion, or have we seen retrenchment, or have we seen some form of maintenance of the gains that were achieved during the early 2000s? And the second, as we came to this, was, do we have the tools to actually answer these questions? And our take was that actually we don't, right? We had a very differentiated and nuanced understanding of social policy retrenchment, in part because of the work by Jacob Hacker about policy drift, but we didn't have a similar nuanced understanding of social policy expansion. And so what we seek to do in this paper is to propose a new conceptualization of social policy expansion to combine it with retrenchment, 2 dynamics that are generally separated and considered in different theoretical frames, and to use that concept to code reforms in Argentina, Brazil, Chile, and Uruguay since the end of the commodity boom, which we mark as 2010. We can change the slide. And so the first step that we thought was necessary was to develop a more sophisticated or a more nuanced understanding of expansion. If we look at the literature on social policy expansion, there's quite a bit of debate about what we mean by it. Historically, we tended to look at social spending. To the extent that spending increased, we tended to think of that as an expansion of social policy. With time, though, we realized that is not the best measure, because social spending can be used to expand access, or to loosen eligibility criteria, or to improve the quality of public services, but it isn't always used to those ends. And so a lot of scholars look at coverage, right? They consider expansion when more people get access to benefits. Some consider expansion when the quality of services is expanded, or the generosity of benefits is increased. But generally, we think if any of these things happens, we have expansion, and we don't think about different kinds of expansion. That differs a lot from retrenchment, where we do think about different kinds of retrenchment. So if we go back to Jacob Hacker's work, he pointed out to us that there are two ways of retrenching social policy, and we need to think about them as categorically different, and as having different political costs, as being one being more politically feasible than another, right? So the first way you can retrench social policy is what we would call outright retrenchment. You privatize services, or you privatize pensions, you slash spending, you tighten eligibility criteria, you reduce benefits in an explicit way, right? And that is sort of historically what we think about as retrenchment. What Hacker tells us is there's a second way that you can retrench social policy, and that is by doing nothing while the structural situation changes, right? So if you hold spending constant in an inflationary moment, by default, you're reducing benefit size. If you continue to provide a set number of income transfers and there's an increased demand and increased unemployment, for example, you are retrenching employment benefits by default, but you're not doing it through explicit actions. And so oftentimes people take less note of that. It happens through a process of what he calls drift or slippage. And so if we look at that retrenchment, one form is somewhat easier, we argue. And here we're building on the work of Holland and Schneider, who talk about easy and hard redistribution. And we're trying to identify easier and harder forms of retrenchment and easier and harder forms of expansion. So on the retrenchment front, we know that policy drift is easier. It's easier in terms of its political cost, and that outright cuts are harder. On the expansionary front, we didn't have any thinking about that. So what Sadie and I try to do in this paper is understand what is easier in terms of institution building, in terms of political costs, and in terms of financial costs when it comes to expansion, social policy expansion. And we argue that income transfers in a setting of mature welfare states with relatively robust income subsidy programs are easier forms of expansion than social services. And we argue that this is the reason because in a setting where, in a relatively mature welfare state setting, which is the case for Argentina, Brazil, Chile, and Uruguay, these countries all have income transfer programs, they have pensions, they have conditional cash transfers, they have relatively high levels of coverage. And so expanding them doesn't require new institution building. Those institutions exist to provide those benefits. On top of it, they're already spending quite a bit. So if you increase benefit generosity, it's a relatively low financial cost compared to what it would cost to increase the quality of public services. Finally, we argue that you get a big political bang for your buck by expanding income transfers, right? People feel it right away. If you increase the value of the conditional cash transfer, the very next month, people end up with maybe $50 more in their pocket. They know that they have $50 more, and they will reward you politically for providing that benefit. So it's also politically easier. Services are different, right? There's a lot of institutional complexity with services. If you want to improve the quality of healthcare, you need to build new clinics. You need to renovate hospitals or build new hospitals. These are financially costly and institutionally difficult forms of expansion. And on top of it, the time horizon for social services in terms of the political benefits you might gain are much longer. If you choose today to start building 20 new hospitals, you are very unlikely to be rewarded tomorrow, and probably unlikely to be rewarded even in 4 years' time at a re-election campaign. More likely, these effects will be felt in the longer term once the institutions are built, once people are able to use them, and once the quality of services go up. Services also have a high human resource cost, that to improve services, you often need to hire more people, more doctors, more teachers, and that can be very financially costly as well. So we argue that expanding social services, healthcare, education, childcare, and the like is harder than expanding income transfers in a setting of mature pension and income transfer systems. So we have 4 different kinds of reform that are possible in this model, and they differ in terms of their ease and their difficulty. We can change slides. So what we do in the paper is we take this, first we build the conceptualization and we look for some ways to try to measure these social policy reforms and code them in terms of whether they were easy expansion, hard expansion, easy retrenchment, and hard retrenchment. And we do this for 4 cases: Argentina, Brazil, Chile, and Uruguay. We pick these cases for 3 key reasons. The first and most important is that they are considered the pioneer welfare states of Latin America, right? They were early welfare state builders. They have mature and relatively developed welfare states. They spend quite a bit as a share of GDP by Latin American standards. They provide pensions, conditional cash transfers, public health, public education, and the like. And so there is something there to expand upon, and there is something there to retrench, right? This is important because if you're just establishing a pension system, it's different than expanding on an existing one. So we wanted a set of cases that were relatively comparable in that they were established welfare states. The second factor that these cases have is that they all experienced the commodity boom, and they all saw slowed or negative growth in the wake of the end of the commodity boom. So they were exposed to this shock of revenue declining and growth slowing down. And so they were under pressure to have to try to figure out what can we do on the social policy front in a setting of more limited resources, which really makes it harder on a government, and the government has to set priorities, and often we can expect that politics will shape some of those priorities. And the third factor is that in all but one of these cases, we saw partisan variation inside the window that we were looking at. So we had both center-left government rule and center-right government rule in Argentina, Brazil, and Chile. Uruguay is a bit of control case, and that we found interesting and well in that we had sustained center-left rule in Uruguay, and we just recently this year had the transition to a center-right government in Uruguay with the victory of the Blanco party. So we picked these cases for this reason, and we can shift slides now. And this next slide is just to show you the governments that we look at. So this is in the paper, we code all of the major social policy initiatives carried out by governments between 2010 and 2008. Really, we go through 2019, though there aren't any big initiatives in 2019. So that means we cover in Argentina, we have the center-left government, the second term of Cristina Fernández de Kirchner. We don't consider her first term because her first term happens during the commodity boom. So we look at her second term. In Brazil, we have the Rousseff administration. So the second part of her first administration and the beginning of her second administration, that's the Workers' Party. In Uruguay, we have the administrations of Jose Pepe Mujica and Tabaré Vázquez, his second administration under the Frente Amplio. His first administration falls during the commodity boom. And in Chile, we have the Socialist Party government, the second administration of Michelle Bachelet, which falls 2014 to 2018. We have the right party rule in Argentina of Mauricio Macri, the Cambiemos coalition. And in Brazil, we have both Michael Temer, who of course replaces Dilma Rousseff after she is impeached and removed from office. And then we have the early years of the Bolsonaro, the current administration. And we look at Chile under both the first Piñera administration from 2010 to 2014 and the current Piñera administration, though we don't have any major social policy initiatives that we've coded out of this recent Piñera victory. We can change slides. So this is just a quick table that gives you a rough overview of our coding of the major social policy initiatives undertaken under all of these governments. And so on the top, we have the left or center left governments, and on the bottom, we have the left or center right governments. And what jumps out in broad, basic terms, just looking at this, is that both the left and right, or the center left and the center right, expand in this era, right? So this might be somewhat surprising to onlookers who said, oh, money's drying up. Oh, the right doesn't like the state. Actually, both the center left and the center right expand, but they are different in how they expand. The center left is more likely to expand in a harder way, to expand social services. And the center right is more likely to expand in an easier way, focusing on income transfers. What we see is that the only cases of retrenchment happen under right or center right governments, but clearly center right governments prefer or easier retrenchment, and we only see harder retrenchment in the case of Brazil, where we see really severe economic and political institutional crisis. So I think there are a couple of key takeaways here, right, that are interesting at the macro, and then we'll go into the specifics of the cases. And that is that, first of all, somewhat counterintuitively, both the center left and center right tend to expand. And if we didn't differentiate between different types of expansion, we might just say, hey, there's no partisan difference here. If we differentiate, we might think that there's an important difference in terms of the political cost, the financial cost, the institutional cost that they face in trying to carry out this expansion. And the second point is that hard retrenchment isn't all that common in Latin America. And this isn't surprising to anyone who studies European welfare states. But for those of us who study Latin America, this is somewhat surprising, right? Latin America sort of was the exceptional region where hard retrenchment was possible. Pension privatization, healthcare privatization. We go back to the 80s and 90s. It's the part of the world where we saw really radical retrenchment of social rights. And it appears that in contemporary Latin America, at least in the recent history, this was less common and less likely. And this may point to the fact of sort of democratic maturity, that these benefits have been consolidated, that the policy legacy effect is taking root in the same ways that it's taken root in advanced industrialized democracies. We can advance to the next slide. So I'm going to walk you through, and you can go ahead and pull up all of the bullet points, Ferran, through all of these reforms. I didn't know that I couldn't. There we go. So I'm going to start with the center left governments and move through Argentina, Brazil, Chile, Uruguay, and then I'm going to move to the center right and just give you some details about what these reforms entailed and why we see them as harder or easier expansion. And then I'm happy to take questions about the details once we're through them. So if we look at Argentina, again, here we're only looking at the second administration of President Cristina Fernández de Kirchner, who was from the Frente para la Victoria strand of the Peronist Party, but she represents the Peronist Party more generally. In her second term, we see the expansion of the Asignación Universal por Hijo, which she, of course, had created in 2009. And so she expands this benefit in that she increases the value of the benefits across time and eventually puts in place an automatic calculus that increases the value so that it keeps up with inflation or more. And she also expands eligibility. She makes it easier for a broader access of the population to get access to the Asignación Universal por Hijo. So we see a coverage expansion and a value expansion of this benefit. We code this as an easy expansion because it already existed. They are, of course, spending a little bit more, but they're not creating new institutions. And again, the political benefits are quite quick on this. She does, though, also engage in a somewhat a harder expansion in terms of expanding early childhood education. She expands the mandatory years of schooling to cover 4-year-olds and provides universal access to 3- and 4-year-old preschool education, though 3 is not mandatory. So this is an important expansion that requires new infrastructure to provide these services to children. And then in the area of healthcare, in a harder expansion as well, Fernandez de Kirchner sets up the SUMAR program, which allows for the reimbursement to public clinics and hospitals for services provided to the uninsured. And so it sets a set of policies or services that will be provided to patients at no cost. Many are primary care preventive measures, but some are higher complexity, more costly procedures, and it expands the eligibility, the access the population enjoys to these set of healthcare services. In Brazil, Labor Party or Workers' Party President Dilma Rousseff creates the program Brazil Without Misery, or Sem Miséria. This program expands Bolsa Familia. It adds an additional cash benefit on top of Bolsa Familia and increases the value of that transfer to families with children under 6 and to pregnant women. So she increases the value of the existing cash benefit for a set of families. And she also expands access to or the coverage of the existing Bolsa Familia benefit. So we code both of those as easy. Again, the infrastructure is in place. It's about expanding slightly the spending, but not the costly process of institution building. Her administration also expanded funding for 2,000 new health centers and increased access to childcare. The program Mais Médicos gives hired new doctors for these new health clinics. So they expanded access to health services by institution building, new institutions, and by human resource hiring. And that's why we code this as a harder form of expansion. So we can turn the slide here and move on to Chile and Uruguay. In Chile, Bachelet comes to office after years of intense student protests, and in 2015, we see the passage of the so-called gratuity law, right? And this responded to student demands for a free university education. What the law does is it puts in place new regulations on tuition, and it guarantees access to university at no cost for somewhere between 120 and 130,000 university students. Critics note that it wasn't what the students asked for. They wanted across the board free university education for everyone. There were a lot of hiccups in rolling this out, but there are a large share of Chilean students now who can attend university for free, and we code this as a harder expansion. Not harder maybe politically. People had been mobilizing for some time for this, but in terms of the financial cost and institution building required for this, for the regulatory bodies needed to oversee the control of tuition costs, this was quite a significant undertaking. Bachelet also passes the so-called educational inclusion law. And this is a law that's very particular to the Chilean education system, which is a voucherized education system. So Chile has 3 kinds of schools. They have purely private, they have purely public, and then they have publicly funded private schools. So the state provides a voucher to families. Families can choose to use that voucher in a private school. Previous to this reform, those private schools could charge families a copay, right? And those private schools could establish admissions criteria. And these were ways that those private schools, despite receiving public funding, were able to select which students they wanted to admit to the private school. And of course, this created huge levels of inequality and segmentation. The inclusion law eliminates copays, and it prohibits schools from using admissions criteria. It also sets up an entirely new admission system for subsidized voucher schools. It's a centralized admission system that randomly assigns students to voucher schools, and then parents, from what they're assigned, can choose from the options they're given whether to enroll their children or not. All of this is an effort to minimize the inequalities built into Chile's subsidized, voucherized system. It was a pretty significant undertaking in terms of institution building. It was very politically costly in terms of what they faced, and we code this as a harder reform. The other thing Bachelet did during her last term in office was she committed Chile to its largest public health spending engagement in its history, and this includes from the moment the founding of the healthcare system. This was the largest and most significant public investment in public health. It was $4 billion. She committed to the hospital construction of 20 new hospitals, 20 that she said there will be 20 new by the time I leave office, 20 in process, and 20 planned. She met those commitments. And these hospitals replaced hospitals that often dated back to the 50s or 60s. They replaced hospitals in portions of the territory of Chile that are somewhat abandoned in terms of access to public health. And so they really marked a significant improvement in the quality of services for people in those regions. It was very financially costly, very institutionally difficult. And politically, she didn't receive, or the government probably did not receive political support immediately for the level of investment that this involved. And we code this as harder expansion. In Uruguay, if we look at the administration of Jose Mujica, a lot of his activities were geared towards sort of cultural rights. Of course, this is the president who legalizes pot and abortion. But Mujica also came to office right after a significant healthcare reform carried out by the first Tabaré Vázquez administration. And his administration is charged with implementing this healthcare reform. They significantly increased spending on public healthcare to meet the demands that were put in place because of the healthcare reform. And public healthcare spending, which previously represented 44% of private spending, went to represent 75%. They invested in a series of new hospitals, so we saw significant infrastructural development, institution expansion. And so we code that as a harder expansion. The second harder expansion is the national care system. This happens at the end of the Mujica administration. It's passed as part of the 2015 budget, and it guarantees funding through to 2017, and then is expanded under the Tabaré Vázquez administration. Again, this is a very new take on state-provided care. So this expanded the existing child care system in Uruguay and layers onto it elderly care, which was new, and seeks to meet the demands first among the lower income population with the goal of universalizing that across time. Uruguay also saw the expansion of maternity leave policy. They increased that from 12 to 14 weeks and increased paternity leave to 10 days. We call this an easier expansion. Uruguay already had maternity leave. It didn't require new institution building. And while the cost is covered by the BPS, the National Social Security System, it's not as expensive as what we saw in terms of building new hospital infrastructure and the like. We can move on to the center right. So if we look at the center right governments in the post-commodity boom era, and I'm going to again start with Argentina and Brazil. In Argentina, of course, we saw the administration of Mauricio Macri from 2015 until last year. And in Macri's case, what we saw was on pensions a mixed record, right? So Macri universalizes access to the non-contributory pension. So he expands eligibility and access to existing non-contributory pensions, which we code as an easy expansion. It's important. It gives more people access. But of course, coverage was already relatively high in Argentina, as was. But at the same time, he changes the calculation used to calculate the value of the non-contributory pension. And this change in the calculation significantly reduced the value of that pension. It's estimated that it generated about $30 billion of savings. And so we can imagine that the benefits default declined, but this was not done by slashing benefit values, but instead by changing the calculation. So we code this as a retrenchment via drift, or an easy form of retrenchment. So Macri moves in both directions on pensions. And in terms of the Asignación Universal por Hijo, also the conditional cash transfer program, he also moves in both directions. So he expands access to the self-employed, which increases coverage and is a form of easy expansion. But at the same time, he puts in place a new formula for automatic adjustment of the value. And that formula did not keep up with inflation. Of course, during the Macri years, Argentina saw significant, very high levels of inflation. And so benefit values did not keep up with inflation, which is one of the things that Jacob Hacker says is a form of policy drift. So we code that as easier retrenchment. So there too, he moves in both directions. Macri does carry out a form, and it's the only center-right government we have that does this, of hard expansion, right? And he does this through childcare. He creates the Early Childhood National Plan. And this seeks to increase daycare enrollment, not all in purely public institutes, but it does involve some public infrastructure building and institution building, and we code this as a harder form of expansion. In Brazil, Michael Temer comes to power right after the impeachment and immediately puts a 20-year cap on all social spending in Brazil. So this is a big, significant, hard cut to social spending. So this is a notable hard form of retrenchment. And he also reduces the value of the Bolsa Familia benefit and makes it harder to access several sickness and disability pensions. So we code those as in the pensions and the CCTs as easier forms of retrenchment. Bolsonaro last year passed a significant pension reform. We code this as a hard form of retrenchment. So Brazil had a pension system that allowed people to retire very early. It allowed people to stack multiple pensions on top of one another. This reform gets rid of a lot of that. It more closely ties individual pensions to years of contributions. It gets rid of the pension stacking. In the end, this reform will likely have progressive effects because Brazil's pension system is actually quite regressive in terms of favoring higher income earners. But it's still a form of explicit hard retrenchment, and therefore we code it as such. We can move on to Chile. And in the case of Chile, and here again, we don't have any clear major social policy undertakings during the Piñera administration, although last week, of course, they liberalized access to the private pension funds, but at the last writing of this paper, that had not yet happened. So these two reforms happened during Piñera's first administration from 2010 to 2014. The first was what we code as an easy expansion. This was an expansion of Chile's existing maternity leave. It was a very significant expansion. It expanded the leave from 3 to 6 months, making it the most generous maternity leave in Latin America. But there is a salary cap imposed on that, and they did not change the rules for access to informal sector workers. So this remains a benefit, like most maternity leaves throughout Latin America, that is really only available to formal sector workers and excludes the lowest income groups. There's also no paternity leave included in this reform. And so we code this as an easy form of expansion because it builds upon an existing right. It doesn't expand to new sectors. It doesn't involve institution buildings. And there's pretty significant political benefits in the short term. On healthcare, Pineda comes to office and there are long wait lines in the public sector. He commits his administration to getting rid of those wait lines. And he quickly moves to do that by transferring public funds to the private sector. So the way he gets rid of wait lines is he allows Chileans to use a mechanism inside of the public healthcare system, which is called the free choice mechanism, which is that they can seek care in the private sector, though they have to pay the difference in cost, and he has the state offset that difference in cost. And so we see significant transfer of public funds to the private sector at this point to meet the wait line issue. And we argue that what this does is it actually in the longer term weakens the quality of public care. It creates a kind of privatization via slippage of Chilean healthcare. And so it's an easy form of retrenchment in that it's sort of an under the table way to start to move toward a more privatized healthcare system without explicitly privatizing the healthcare system further. We can turn to the conclusions now. So this paper presents a new conceptualization of social policy expansion and retrenchment. We, of course, are trying to combine two things that many scholars have separated, and we're trying to see similarities by finding institutional costs, financial costs, and political costs, and thinking about easy and hard in those terms. We believe it provides a more nuanced understanding of social policy change and allows us to see that different governments have different ways of thinking about social policy expansion. We don't argue that this is a definitive test of left and right. Other things could have been driving these changes between countries. There wasn't space in this paper to control for those many other things, and future research absolutely should. But we do think that it points to possibly interesting differences between the left and right in terms of the areas they prioritize and the kinds of costs they're willing to take on for expansion. So when we've explored this in the 4 cases, we turn over interesting differences between the left and the right and differences that we think warrant further investigation. But we also think it points to some interesting lessons for the region. We think that this points to a certain maturity of Latin American democracies in that hard retrenchment that used to be so common in the region is now much less common. It occurred only in the context of Brazil, which was undergoing severe economic and political crisis. And we think that, in fact, the fact that we see both governments of the center, left, and right expand in one way, shape, or another, despite economic constraints, points to the fact that there's a growing notion of social rights in Latin America, and there's a recognition that voters expect the state to provide certain benefits, and we can see that play out. Finally, we think that, differentiating, presenting this conceptualization at this current juncture where we are in the middle of a global pandemic, and a pandemic that requires creative and fast and significant social policy responses, both in terms of income transfers and down the road public healthcare infrastructure, this conceptualization could prove helpful in understanding different forms of responding to the COVID crisis and the ways that states sort of reformulate their welfare states in the wake of what is proving to be a very devastating experience in the region of Latin America. So I will leave it at that and open it up for questions now to all of you who've been patient. Thank you very much.